Hello, and welcome to Radiance Revealed, the podcast. I'm your host, Dr. Jen Haley. I'm a board-certified dermatologist, fitness enthusiast, nutrition expert, and global explorer that over the years has uncovered that your skin is a true representation of your internal health. Each week, we will chat with leading health, wellness, and even spiritual experts who will reveal secrets to true health and vitality. My goal is to help you change small habits to give you the power to create a more balanced, aligned, and elevated version of yourself. Now let's dive in. Hi, everyone. Welcome back to the Radiance Revealed podcast, and I'm your host, Dr. Jen Haley. I am a board-certified dermatologist for 20 years now, and I studied nutrition undergrad at Cornell University. And I treat all ages, all skin types, and I've traveled around the world, I've lived around the world, and I really enjoy evaluating and treating skin from all different areas of the globe. And today I wanted to talk to you about acne. Acne is a very complicated process, and there are so many treatments out there because one treatment does not work for everyone. So I wanted to give you some truths to expel the myths that are just out there everywhere. There's so much misinformation, and I hope to, by the end of this podcast, to share some good information that you can utilize in your life for the most clear skin for you and the people you love. So with that being said, the first thing I wanted to discuss was the different types of acne. So when you go to a dermatologist's office, basically what we look at is we evaluate the type of acne on your face and on your chest and on your back. And that's why I might have two siblings in my office and they'll walk away with different treatment strategies because I'm seeing different things clinically. So while they have the same diagnosis, the treatment is going to be different because the presentation of the acne is different on each person. So the first type of acne lesion we look at are called comedones, and those are basically blackheads and whiteheads. So we call them open and closed comedones. Open comedones are blackheads and closed comedones are whiteheads. And they're not inflamed. They're basically just bumpy. You can feel them more than you can see them. And what causes the black in a blackhead or an open comedone is basically trapped oil with skin cells that's become oxidized because it's exposed to oxygen in the air. So that's what makes it black. It's not dirt. It's actually just oxidized sebum. And, those type of acne lesions can be a little bit challenging to treat because they can take a long time to treat because we have to basically exfoliate all of the skin layers to present the new skin as clear. So we look at how many open comedones somebody has, how many closed comedones somebody has, and then we look at inflammatory papules and pustules. So those are basically ruptures under the skin of the oil with the skin cells that have become trapped. And that sets up a lot of inflammation in the skin. And that you can see from a distance how much inflammation is going on. And then we also want to look for cysts, deep pockets of inflammation with a cystic reaction underneath the skin. And then I always want to look at the chest and the back and areas that people might be embarrassed to show me to see if there's acne involvement there, because that's going to change treatment a little bit if there's other areas involved. So that's our first analysis. How many open and closed comedones does someone have? How many papules? How many pustules that are inflamed? Are there cysts? What areas are infected? So that's the beginning of our analysis when you see a board-certified dermatologist who is specialized in treating all things skin. Then we basically, want to see that type of acne. Well, we don't want to see it. We typically do see that type of acne in teenagers, right? But what I also see, since I've been training the late 1990s, early 2000s, I see a lot of women with adult hormonal acne. So all acne is hormonal, but really adult acne. And that presents typically very, very differently than we see in the teenage years. So what we'll see is deep, painful, often painful cystic acne on the jaw, on the chin, in the mask area of the face, but typically the jaw and the chin area. And less comedones, less blackheads and whiteheads, more of that deep cystic acne. And the thing about that type of acne, when I speak with the women that are having that acne, is if they try to pop the pimple, nothing comes out. It's just going to cause a scar, so don't pop it. And also the acne can be quite painful and they last a really long time. So when you're in your teenage years and you get a pimple, it's usually gone a week after prom, after about 7 to 10 days. But when you get this adult hormonal acne, you can have it for 3, 4 weeks. And then by the time it resolves, it usually leaves scarring. So that's no fun. And the scarring with that can be pink if you have fair skin, or it's often hyperpigmented and leaves a brown area of scarring that can last many, many months if you have any skin of color, whether you're Asian or Hispanic or African American or somewhere in between, as most of us are blended nowadays. And then the other thing I want to mention is I don't want anyone listening to confuse acne with acne rosacea or rosacea. Rosacea is a different condition, and we can talk about that on another podcast because it's quite complicated as well. But acne will often present with centrofacial. So it involves the central part of the face, the forehead, the nose, the middle part of the cheeks, and the chin with those inflammatory papules we discussed. So red bumps. And there are never comedones with acne rosacea. So rosacea does not have comedones. It's sort of a constant redness. There's many subtypes of acne rosacea, but rosacea is a separate condition from acne. Although many of the lifestyle recommendations I'm going to make are going to help with both conditions, and they certainly won't help. They won't hurt you. The other thing about rosacea that people don't always connect with is that rosacea can also affect the eyes. So you can get rosacea in your eyes, and the symptoms of that can be some redness. It can feel dry. You can have like a gritty, irritating foreign body sensation in your eyes. So be aware of that the skin is not only affected. And for those of you who know me, you know that I look at the skin as representing all of the internal organs, also your entire health. So we don't need to invade the body to diagnose anything. We just basically look at your skin and we can see what else is going on inside your body. Often, if the skin is inflamed, then there's some inflammation going on inside the body. And hopefully it's transient. A lot of times we get hives or rashes or redness and it goes away, right? Because it's a transient inflammatory process and our body goes back to homeostasis. But when that doesn't happen, that's when we require further investigation and analysis of what's going on inside the body. So, what are some causes of acne? So, the way I speak, I want you to all to understand where I'm coming from because I've been around for over 20 years in dermatology, longer as a physician, about 25 years as a physician. And things that I were taught as being absolute are not absolute. We believe completely different things now. So the information I'm imparting to you today is based on our current understanding of what we know today. So that will also evolve and change, and we will evolve and change with it, right? But what we do understand today are these causes of acne. Number one being genetics, right? So everything I'm discussing today, if there's a lifestyle thing that we're doing or, some sort of a cleansing practice, if you have genetics that predispose you to acne, these lifestyle things aren't always your fault. Like it's not your fault if you have acne. You're just more predisposed to it than other people based on your genetics. So understand that genetics plays a large role. I can have someone who has a perfect life as far as we understand, and they still may develop acne if they have a genetic history of it, if their mother or their father had really severe acne growing up. So, if your parents had severe acne as a teenager, you're more likely to have severe acne. So all the holistic treatments in the world may not help if you are genetically predisposed. You may have to go to some more aggressive medical treatments. The second cause are hormonal changes. So that's why we see acne in the teenage years. It's very uncommon to see acne in someone under the age of 10. But when hormones change, that's when we start to see acne. It's fluctuating hormone levels, okay? And during puberty is a common time because the excess hormone productions, especially the androgen hormones, such as testosterone, can increase oil production. So it starts with oil, areas of the body that have a lot of oil glands such as the face, the neck, not the neck, the face, the chest, and the back tend to have acne. So these elevated androgen levels stimulate the sebaceous glands. The sebaceous glands are our oil glands, and then oil is produced. And then as oil is produced, it holds on to the skin cells that would naturally exfoliate, and it can clog the pores and cause acne. So, what are some other things that can increase these oil gland productions? Stress is a big one. So, right before I start a podcast or before I do a presentation, or if I'm having a very stressful day, I'll notice my face is extra oily. Okay. So, stress can certainly increase your androgen levels. Short periods of time, that's not going to cause acne. Long periods of time, yes, absolutely it can. The other thing is when you have high stress levels, high cortisol levels, it throws off the hormonal balance of the skin. I mean, of the entire body. So when the entire uh, homeostasis or the entire balance of our hormones is thrown off and it's no longer in balance, what can happen is it will predispose you to having the effects of high androgen levels. So, cortisol basically does this by displacing active testosterone from the receptors of the skin and of the rest of the body. So, just know that stress and an increase in cortisol can throw off the balance of hormones, stimulate oil production, and cause acne. So, women who have polycystic ovary syndrome, so PCOS, they often have elevated androgen levels, and then changes during the menstrual cycle will often predispose women to develop acne, primarily in the chin and the jaw area that I had mentioned earlier. The third thing that causes acne is plugging of the pores. So you have the excess oil production from often hormonal shifts, and then the skin cells that naturally turn over every day, what's happening is the oil holds on to those skin cells and they get stuck in the pores and they plug the pores. So that's how the pores get clogged and plugged. And the clogging and the plugging of the pores cause the blackheads and the whiteheads of the area. And we call them comedones. So then the next thing that causes acne, just say those comedones are sticking around for a while and there's plugging of pores and the oil in the skin cells gets trapped underneath. Then what happens as there's no more room for them to expand is it ruptures underneath the skin inside that pore. And then bacteria that live on the skin now overproduce and cause a cascade of inflammation under the skin. And that leads to those inflammatory papules and pustules that we discussed. So there have been links to, we used to call it Propionibacterium acnes or P. acnes. And we now call it C. acnes or Cutibacterium acnes. That is a bacteria that naturally resides on the skin. And it's also linked to this inflammatory type of acne when it's out of balance with the healthy bacteria and healthy microbiome on the skin. There's no all good bacteria, there's no all bad bacteria. Everything has to be in perfect homeostasis, and we want to have a good balance of things. So when this inflammation happens, the C. acnes basically multiply and they cause an entire inflammatory cascade. And it basically causes this inflammation. But I don't want you to take away from this that C. acnes is the bad guy, because there are certain subtypes, there's certain serotypes. It's not the right word. But there's basically certain phylotypes. I'm sorry, that's the correct word. There's certain phylotypes of C. acnes that are very good and very necessary in the body because they actually keep Staph aureus infections from progressing. It keeps staph at bay. So C. acnes can be good, but there are certain phylotypes that can be linked to acne. But killing all C. acnes is not going to be our goal here. And that's not really where we go for treatments nowadays. So basically, as I had mentioned, when the plug pore expands and it ruptures under the skin, this causes a significant inflammatory cascade, and it can send signals causing something called matrix metalloproteinase, which can basically come to the area and it kills off the collagen. And that's why sometimes when people have severely inflammatory acne, it can leave indentations and divots in the skin and atrophic acne scars. So why do we even treat acne in the first place in the teenage years? We do it for two reasons. This is why we do it until somebody often outgrows it. Number one is to reduce the amount of scarring, obviously, because we don't want someone to have scarring for the rest of their lives. And number two, it's so they can feel better about their skin, right? Because the way we show up in the world, is important to most people in giving self-confidence and things like that, especially during the teenagers. So what I want you to understand, though, about inflammation is that when, just say you have a pimple that you want to pick, right? If you squeeze a pimple, and if you're on YouTube, you could see this. If you squeeze a pimple, as much ruptures above the skin, ruptures below the skin. So going back to physics 101, for every action, there's an equal and opposite reaction, right? So as much as comes out also explodes below. And now we understand that when there's a rupture below the skin surface, it causes an inflammatory cascade. It attracts certain bacteria to the area. It attracts cytokines to the area. It sends enzymes to the area that can eat up the collagen. So that's why it's really important to do everything in our power to reduce the inflammation, therefore to reduce the scarring. Whether the scarring is just a red spot for many months or whether the scarring is a discolored brown area that can be there for a while, because we know that in anyone with tinted skin tone or with skin of color, so if you're very fair skin, we call it Fitzpatrick 1 and 2, you usually have a red spot if you have a scratch or a pimple, and the red spot can fade away in a month or two, right? And if you are Hispanic, Asian, African American, or Indian, blended skin types in between, what will happen is the pigment cells, the melanocytes, get attracted to any area of inflammation. So whether it's a scratch, a rash, eczema, or acne, the pigment cells will go to the area thinking there's a party, that inflammation is not a party, but they think it's a party. And then when the pimple actually goes away, the pigmentation can persist for a while. And nobody really wants that because sometimes that could be more disturbing than the acne itself. But when I treat people, we have to treat the acne first because the acne is the cause of the pigmentation. We can't focus on the pigmentation until the acne is resolved. So I want you to just understand that. Okay, so I want to get the point across that bacteria itself is not harmful. It's the imbalance of the bacteria. And that's why everything is about balance. We don't have 100% good of anything. We don't have 100% bad of anything. It's all about balance. Okay, the next cause I want to talk about are dietary factors. So there are a lot of variables from person to person here. And when I was in training, so I did my undergrad in nutritional sciences and biology at Cornell University. And I was taught in medical school, because we're not taught very much nutrition in medical school, really none at all, that diet played absolutely no role in affecting acne or skin or anything like that. And that never really made any sense to me because I thought in my mind, okay, when we give a patient medication, we give medication by mouth. Yet when somebody eats something, it plays no role on their health. Like, how is that even possible? So I just always knew in the back of my mind. And then I did this really cool thing called listening to patients. And I would have patients who'd have very clear skin for months and months. And then they'd come back in, usually after the holidays, and say, Dr. Haley, my skin is all breaking out. And I'm sure it's because I had all this sugar and all of this, food that I don't normally eat over the holidays. So it doesn't hurt to stop those things for any reason. So we would stop it, skin would get clear again. So, but this does vary from person to person. And there was a prominent study in 1969 showing that chocolate did not cause acne. So when you take a little bit of a closer look at the study, basically the control group, so one group was given a bar of chocolate, and then the control group was given a bar loaded with sugar with no chocolate in it, just all the sugar, but no chocolate. So both groups broke out equally, right? And now we understand that's because sugar is the culprit, not chocolate. So if you want to go eat 99% chocolate, 90% chocolate with very little sugar, you're probably okay. And it's sugar that's the issue. Now, the thing that I want you to understand is our body sees processed carbohydrates as sugar. So just say I have some pasta or some white rice and I eat it, my body's going to break that down into glucose rather rapidly. And one way to measure this is if you have a continuous glucose monitor on. There are some companies that you can get that through, or you can get it through your doctor. And you can monitor your sugar levels. So everyone is affected very differently. So for me, if I have white rice, and I love sushi, so I'm sticking with sashimi from now on. But if I have white rice, my glucose level will bump up to the high 200s. That's obscene because really you want to be, in the low 100s after a meal, and mine would be jumping up to the high 200s. So I don't manage glucose very well because of my genetics. So I can't really cheat. My body's pretty honest. But everyone's different. Some people can have white rice and they do okay, but yet, something else might spike their glucose. So you want to have fairly even blood glucose levels throughout the day and avoid highly processed carbohydrates and obviously avoid sugar. And, when we look at certain groups, like there's the Kitavan Islanders of Papua New Guinea and the Aceh hunter-gatherers of Paraguay, they have zero acne in their population. Both groups eat very low glycemic diets and they have no refined foods found in Western diets. So when we can study those populations, we can do a little bit more of an analysis of what's going on. And, when you take cultures where they don't normally have processed foods and you move to an area where there are processed foods that are rich in carbohydrates that are easily converted in the body to simple carbohydrates and spike glucose levels in the blood, people are going to be more predisposed to acne and other inflammatory processes in the body. So first thing you can do is to avoid processed food and sugar and try to eat whole real foods. So things that have no labels on them is always the best thing to go to. Fruits are okay, Fruits aren't really an issue, but I mean, I personally think fruits are meant for summertime. There's not many fruits that we should be eating all year round. And I will talk about the importance of rhythms and cycling in future podcasts. The second thing that we found to be linked with acne, and this is very inconsistent. Some people are affected and some people are not, but it's dairy. So dairy products can be quite inflammatory and really affect certain people more than others. I mean, in fact, I have two teenage boys, and one of them, he will break out if he has dairy and the other one won't. So the only way to really know if you're affected by dairy is to stop it for 8 weeks. So you want to stop it for 6 to 8 weeks minimum. And then, or until your skin is clear. And then if you restart it and you break out, that's a culprit for you. And ironically, skim milk causes more acne than whole milk. So it's not the fat. And that could be because there's more of an insulin spike. There's more sugar in the skim milk. We're not really quite sure, but we're not sure of the mechanism of action. It could partially be because there's a lot of growth hormone injected into our dairy cows in the United States, especially. But even if you get grass-fed RHBG free, where they're not injected with hormones, I'm still seeing acne in my patients, and it could be because it bumps your IGF levels, it could increase your oil production, or just because it's overall inflammatory. So, if you really love dairy, I'd stick with smaller animals like goats or sheep. But if you're struggling with acne, I'd take a break for 2 months and then slowly start. Maybe start with yogurt or kefir, something that is not as linked with acne. And then if you remain clear after 2 to 6 weeks, then you could slowly reintroduce other things and see if it's an issue for you. So I don't completely avoid dairy because cheese is like one of my favorite foods, but I know my skin looks different and I'm just really inflamed when I have it. Sometimes my joints will ache and stuff. But I find that if I don't have it often, there's like a buildup effect. If I don't have it often, it doesn't affect me as much. That's just my personal experience. And then as far as athletes, I have a lot of um, friends, a lot of patients who are competitive athletes and they need to get the protein in. And I find that casein protein is a lot more inflammatory than whey protein as a supplement. So just remember that after you eliminate it, it could take anywhere from as soon as 2 weeks, but really closer to 8 weeks to see skin improvement. So, when we're dealing with any treatment for acne, basically what I tell people is that what we're seeing on the top layer of our skin, if you're on YouTube, you could see my skin today. So, what I'm seeing on my skin is about 2 to 3 months old. And then when you grab your skin in the deep layers below that, there's already acne formed in there. And it's going to take 2 to 3 months to surface. So when we do any treatments, we treat an entire area. We don't spot treat really. We treat an entire area because we're not just treating the acne that's there. What we want to do is we want to prevent acne from forming. So we want to create clear skin. We don't want to just chase and treat what's already there and then chase and treat what's going to show up over the next 3 months. We want to completely form clear skin. We want to reprogram the skin cells to be clear and acne free, no plugging, balanced oil, balanced microbiome, etc. Okay, the next cause of acne are environmental factors. And this is really what I think is the main issue in women with hormonal acne. So cortisol is a big thing. Cortisol stress is a really big thing. And most of us are so busy to do, meditation and mindfulness and taking care of ourselves. So the easiest thing I find to bring cortisol levels down and balanced, because we don't want them too low, right? We want that cortisol a little bit elevated in the morning to get us up out of bed. And then we want it to reduce during the day so we can get ready for sleep at night. I like Dr. Andrew Weil's 4-7-8 breath. So you can look on YouTube and you can find the 4-7-8 breath. But basically, you inhale through your nose for a count of 4. 1, 2, 3, 4. Hold it for a count of 7. And exhale through your mouth for a count of 8. And then cycle that through again. Inhale for 4 through your nose, hold for 7, and exhale for 8. I will do this at the stoplight. I will do this in the grocery line. I will do this anytime I'm waiting somewhere. And if you can do 4 cycles morning and 4 cycles at night, it's shown to make a huge difference, like in blood pressure, in balancing things in 4 to 6 weeks. And then you could just throw it in any time of day you want. But really, 4 cycles takes no time at all. And there's no cost. It's not sexy. You don't have to buy anything. It's free, but it works. So that's what I recommend for that. The second thing I really have a problem with is there are so many endocrine disrupting chemicals in our environment and they disrupt hormones. And when I was training in the early 2000s, I was the only woman in my program. So I would get every woman who had acne and I would see so many women. Some days I'd see 10 or 15 women with hormonal acne around the jaw, around the chin. Very frustrating. Nobody wants to have acne when they're in their late 20s, 30s, 40s, and even 50s, right? And I asked my program director, he was quite a bit older. I said, "Did you used to see this much acne?" And he said, "No." So he did not see this much acne. This is not something that has been around a long time. It's definitely been around 20, 30 years. And so has plastic. So I think plastic is poison. And I understand the need for plastic. It makes things convenient, it makes things light. Shipping things costs less money when you don't have to use metal and glass and you could use plastic, et cetera, et cetera. But plastic is a hormone disruptor, it's an endocrine disruptor, and it can act to signal estrogen receptors in the body. It can throw off the whole hormonal natural balance of our bodies. So do everything that you can to avoid coming into contact with plastic. So, how do you do this? Okay, let's see. Drink out of Longevity Labs, spermidine plug. Do everything you can to drink out of a hydro flask. I break things, so I don't use glass as often as I should. I do mason jars for the house. If I'm, making like macadamia nut milk or something like that, I'll use a mason jar. Get glass containers for your leftover foods. Don't put it in plastic. And the other thing is when you go get coffee, if you get coffee from a store, the lining of those paper cups is lined with plastic. And then you're putting a hot beverage in there, and there's an accumulation of plastic and hormone disruptors in the body. It's really impossible to completely avoid, but what you can do is just do everything you possibly can to avoid your food and water coming into contact with plastic by making these simple substitutions. So that's what I recommend. And then try to avoid as many pesticides and herbicides as possible. So get organic when you can. I feel like the EWG.org Environmental Working Group, EWG.org, they have really great information. I couldn't repeat all of it here. And they basically will list the dirty dozen, the dirtiest foods that have the most pesticides in it. And, what things you don't necessarily need to get organic, like bananas, and avocados and things like that. And that way you can kind of, focus your money and your budget towards what really matters. I mean, for instance, I will not buy a peach or blueberries or apples that are not organic because I know those have high pesticide levels. And I think I heard that the benefits that you get from a blueberry are basically deleted and outweighed by the amount of pesticides they have if they're not organic. So I definitely would get those organic. And then what I really would like people to do, and this can get expensive, but you can look around, is buy meat that is 100% pasture raised and grass fed, because we are what our meat eats. So I was a vegetarian for many years in my 20s. It didn't work for me. It does not work for my genetics at all. I do really well with a higher protein, higher fat, lower carbohydrate diet. And because of that, I have to source my meat from a really good place. There's a couple companies I like. There's Cook's Venture for chicken. It's a regenerative farm, and sometimes they have beef and they have pork. I don't eat pork. I don't like it. But they do have pork there. And then as far as if you can get wild meat, that's great because they eat everything wild. But there's a company called the Honest Bison Company, and then there's Maui Nui Venison that makes some really great bison and venison and beef and elk. Elk also I get from them. So those are some options, because really what we're putting in our mouth is going to show up in our body and on our skin. And it's so amazing how many people I've treated over the years for acne, and they come in 2 to 3 months later and they've lost 15, 20 pounds and their joint pain is gone and they have more energy, because what I'm recommending for acne is also going to benefit your health. So just be aware of that. So the environmental stuff makes a difference. There's also other endocrine disruptors, which we can do a deeper dive in the future on. But like the receipt at the store, don't touch that. There's phthalates on there that can cause disruption in your body, especially if you touch hand sanitizer and then you touch the receipt. It's just going to get absorbed even more. So be aware of that. And then the last thing I want to discuss as far as causes of acne are some of our cosmetics and skincare products. So it should be on the label when you purchase products. And it's pretty common nowadays to say non-comedogenic. So non-comedogenic, you want to get makeup and skincare that's non-comedogenic, and it will be on the label. And personally, I don't feel that most people need a lot of makeup. So I just wear tinted sunscreen on my face. That's all I have on right now is just tinted sunscreen. And I find that most of the people I work with if we can find the right tinted sunscreen for them, it will, number one, prevent acne. Um, if it's the right non-comedogenic type, it will prevent wrinkles. It will prevent breakdown of collagen over many years. And it also covers up any blemishes. It covers up any discoloration you have because of the tinted skin tone. I mean, the tinted tone, if it matches your skin. So it doubles as sun protection and as a base for makeup. And you really have to play around with it for your skin type. But some of my favorites are Elta MD. I feel that Elta MD makes some really nice ones. I like the elements from my skin type, and I mix I mix 5 pumps of that with 1 or 2 pumps of the Elastin, Alastin, because it's a little bit darker, and the Elta MD is a little lighter. So I mix those two together. And there's just a lot of nice ones out there. La Roche-Posay and Helios SPF 50 tinted, I really like for patients with skin of color because I find that it doesn't make the skin look ashy like a lot of the mineral sunscreens can. So finding a nice tinted sunscreen is going to be probably the best thing you can do for your skin overall. And what you want to look for is an SPF 30 or higher with zinc oxide as your main ingredient. Avoid the chemicals ingredients and just look for zinc oxide. Okay, so those are some of the causes. Quite overwhelming, different for everyone. And that's why the treatments are going to be different for everyone. So the skincare industry is a $1 billion industry because there's not just one treatment that works for everyone. If there was, there would just be one option. There's many, many options because finding the right formula for your skin type is going to be essential to give you success. So let's talk about some of the over-the-counter options first, as far as Western medicine goes for acne. So benzoyl peroxide, it's kind of everywhere. It's an antimicrobial, so tends to kill bacteria. It's not focused. It kills a lot of bacteria. And it reduces excess oil and it reduces inflammation. The thing about benzoyl peroxide is that in about 10% of people, it can cause a lot of skin irritation and a red burning stripping sensation from the skin with the skin. So I don't always love it, but it's a great start. It's a great thing for somebody to start with if they are limited to over-the-counter options and they cannot consult with a board-certified dermatologist. So I do prefer a benzoyl peroxide in a cleanser more than a topical medication. I just find that it's less harsh on the skin. And any cleanser you put on your skin, you want it to sit for about 2 minutes so it can penetrate the skin. So I'll often have people massage it and rub it into the skin and then leave it on for 2 minutes. So brush your teeth, whatever you need to do, and then you can rinse it off and do your next steps. Okay. And that's how I like it. I don't think 10% is necessarily any more effective than 5%. So, if you can find a 5% formulation with maybe some aloe or some gentle ingredients, it's going to be better for your skin. The other thing to note about benzoyl peroxide is that it can bleach your towels, it can bleach your clothes, it can bleach your hair and your eyebrows, and it can bleach your bedding as well. So that's why I prefer the wash over the topical, because I found that the topical, if you're sleeping at night, you're going to bleach your sheets. If you're sweating during the day, it's going to run down and bleach your clothes. So just keep that in mind. Okay. So the second thing that we've been using for, close to 50 years now, very scientifically proven, lots of misinformation out there, are retinoids. So vitamin A type of products, they come in many different names: tretinoin, retin-A, adapalene, differin is now over the counter. Adapalene is differin over the counter in a 0.1% formulation. The 0.3% formulation is prescription still. There's tazarotene. There's lots of different vitamin A products. And these work by promoting skin cell turnover. So the skin cells turn over quickly, and then the pores can't clog with dead skin cells, right? So if we can help naturally unplug the pores, then they don't get plugged, and then the comedones and the blackheads and whiteheads go away, and then they can't form inflammatory papules that we discussed earlier. The thing about retinoids, though, is if you use too much or you use too high of a strength, that uh, removal of skin cells is going to appear to be a lot of skin peeling and a lot of irritation. And if you can ride through it, you'll get results quicker, but you don't really need to do it that way. You can just start with it using it 3 times a week. So often I find that people apply too much of it. So just say you're using over the counter different. What you want to do is take a pea sized amount or a pearl sized amount. And then if you could see me on YouTube, you'll see I'm dabbing my forehead, a little dab on the left cheek, a little dab on the right cheek, and a dab on the chin, and then blend it all together. And avoid the creases around your nose, avoid the creases around your mouth, because if the product pools in that area, what's going to happen is it's going to cause excessive peeling of that area and irritation, and you're not going to like it and you're not going to stick with it. So less is more with retinoids. Using less is going to be more. We don't want to use prescription strength retinoids if you're pregnant because it reduces cell turnover. So theoretically, if it's getting absorbed by your body, it can, affect the fetus. And the other thing about retinoids is if you're using them, you want to stop about 10 days before if you're getting any waxing, because it's reducing the adherence of keratinocytes. And if the keratinocytes, the top layer of skin that's dead skin cells, is released, when you pull off the wax, it's also going to pull off extra skin cells. So keep that in mind because, we don't want you having burn appearances on your face. But I feel like retinoids are a really good addition to most anyone's regimen, whether it's treating pigmentation, acne, and just anti-aging in general. So I don't really love it for rosacea. Short term, it can make rosacea worse. Long term, it can improve the vasomotor instability or the blood vessel instability of the skin, and it could actually help with rosacea long term. But it really needs to be walked through with a dermatologist. It's not something I really recommend you try on your own. Okay, the next treatment is going to be salicylic acid. Salicylic acid's in everything. It's in a lot of things, and it doesn't work equally in everything because the formulation isn't the same in everything. So just because a product has an ingredient in it doesn't mean it's going to penetrate and be as effective as another product. That's why you want to look for medical grade products and products that have more proven efficacy, something you can get in a dermatologist's office. So salicylic acid I really like because it's attracted to oil glands. So it's a beta hydroxy acid and it's derived from the willow bark tree, which is the same tree where aspirin comes from. So it has a lot of calming and soothing and anti-inflammatory properties to it. But at the same time, it also exfoliates and unplugs skin cells. So I really love it. I love it in a cleanser in particular. And just to help unplug pores, to reduce inflammation and to kind of even out the skin, basically, in general. And I love the fact that it's attracted to oil because it's going to selectively go to the plugged up oil glands as opposed to glycolic acid, which can be a little bit more irritating and isn't selective for oil glands. And so that's it with salicylic acid. So it's a nice thing to incorporate into your regimen. Often I'll use it as a cleanser, either once in the morning, twice a day, depending on the type of acne. Azelaic acid. Azelaic acid, it's antimicrobial and anti-inflammatory. It's something that we use in pregnancy as a prescription that's safe in pregnancy. Honestly, I feel like it benefits acne really modestly. It wouldn't be like my go-to only thing. I have not been overwhelmed with how great it is. If I think somebody has rosacea and acne, I think azelaic acid is nice. If someone's pregnant or planning to be pregnant, azelaic acid is nice. If it's in a formulation with some other actives like niacinamide and salicylic acid, I'd say sure, go ahead and add it. It also has a little bit of a lightening properties as well. So it's a nice add-on, but it's not a solo wow kind of product for me. Okay, and now I'm going to get into a little bit of a controversial treatments. So what we use in the office often are topical and oral antibiotics. And they work by reducing bacterial colonization, But the risk is they can throw off the balance of healthy bacteria. So, 20 years ago, we wanted to slam all the bacteria. These are the bad guys. Let's get rid of them. Let's help treat acne. Now, what we find with these antibiotics is that the reason they work best is because of their anti-inflammatory properties. So we've altered the dosing of antibiotics to make them submicrobial. So instead of giving like 200 milligrams of doxycycline, what we can do is we can do 40 milligrams or even 20 milligrams twice a day. And that doesn't affect the bacteria in the body. The bacteria stay the same, but it has anti-inflammatory effects. So that's why we're using it for the anti-inflammatory effects, which is pretty wonderful. And we find that they work better and longer if you can use benzoyl peroxide with them. So that's where I will incorporate a benzoyl peroxide wash if I have somebody on antibiotics. So that's how we're using antibiotics nowadays. Um, I personally prefer isotretinoin, which is the brand name Accutane, which no longer exists. There's only generics under isotretinoin. And that is derived from vitamin A, which we talked about earlier with the topical retinoids. And it basically will dry up the oil glands. And if the oil glands are weaker, you're not going to have that entire cascade of what we talked about with acne. So I feel as though isotretinoin has gotten such a bad rap. And if it's used properly, it is the most amazing treatment for acne. It prevents permanent scarring where we didn't have options previously. And the way we dose it really depends on how bad your acne is, where it is on your body, and your tolerance, right? So we go by weight. And what matters at the end of the day for, permanent cure, and I'm doing this in quotes because we really want you to have a permanent cure of acne, is that it will we go by weight and we want you to get a certain amount in your body per weight. So we can give you a higher dose for shorter periods of time, like 4 or 5 months, and it can cause all the things you hear about on the internet that, in my opinion, are overly exaggerated. And, uh, or you can do a lower dose for a longer period of time because what matters is the total cumulative dose you get in your body, right? So if you do a lower dose for longer periods of time, you're not going to have as much dryness. You won't have, joint pain and, any other things typically. And you do have to get checked every month because there's a zero tolerance for getting pregnant on this medication. But it works. I've seen it over 20 years work very well. It's been the only thing we've had for some people. And I would not discount that because at the end of the day, it's natural. It's from vitamin A. Yeah, of course, it's a medication, but it's originally from vitamin A. Now, why don't you want to take high doses of vitamin A? You don't want to take high doses of vitamin A long term. Number one, it could be teratogenic and cause malformations in a fetus. Number two, it can basically burn out your liver. So you would want to get isotretinoin. You can do that with the board certified dermatologist, and there's regulations behind it. So just know that that's an option, and it works wonders for people. Okay, so there we discussed the medical treatments that are around nowadays that are fairly common, fairly proven by science. I want to talk a little bit about some of the holistic therapies, some of the more natural therapies for acne that work. So the first thing there are at-home devices, there's in-office devices, is blue light therapy. So blue light therapy with a wavelength of 407 to 420 nanometers, it can result in a 60 to 73% reduction in acne. And I've been, using blue light therapy home devices for, probably about 15 years now for acne. Just like everything else with acne, some people it works really well for, some people it doesn't. I feel as though it works better for the inflammatory acne. So when we're talking about the type of acne that somebody has, if someone has more comedones, the blackheads and the whiteheads, I personally feel that the salicylic acids and the retinoids work the best. If somebody has, and even azelaic acid, if somebody has more inflammatory acne, that's where the antibiotics, that's where the isotretinoin, the Accutane, that's where the benzoyl peroxide will work a little better. And I also think that blue light therapy works more for inflammatory acne. Now, red light is another option. And red light in the biohacking world, we recommend it all the time to help stimulate collagen, improve mitochondrial health, all these other things. And red light penetrates a little bit more deeply. So whereas blue light will maybe maybe help rebalance some of the microbes, some of the bacteria in the skin. It can kill off some of the bad, quote, bad bacteria. The red light penetrates a little bit more deeply in the skin, and it can help to reduce the oil glands and reduce inflammation. And red light can improve acne. In some of the studies, they're all small studies. Both of these, the blue light and the red light, have been very, very small studies without a lot of power. And have been shown to reduce acne by about 59 to 66% for the red light. But the combination of blue light and red light tends to give the best results. And there have been some small studies showing a reduction in inflammatory acne by 76 to 83%. So we still need larger studies, but it's not going to harm you. So if you can get access to a blue and red light, that would be something good to try in combination with other therapies. We talked about diet. So the number one thing that I'm going to recommend, and the least expensive thing for people, in addition to topical skincare, is going to be a low sugar, avoiding processed carbohydrates, just avoid processed foods in general as much as you can, and cutting out dairy for 8 weeks. Give it 8 weeks. Really give it till your skin is clear. And then, if you want to try to reintroduce dairy, my first thing is always to reintroduce whey protein, just because protein in muscle is important for me where I'm at in my life and for most of my patients. So we know that the dairy and the sugar are definitely associated with acne. And as far as doing other crazy things, that's not really something that I could recommend for acne at this point. Okay, now topical pumpkin seed oil is interesting because it blocks 5-alpha reductase activity. So it can be helpful for hormonal acne, that adult acne we talked about on the chin and the jaw. So it also can help for some hair loss as well, topical pumpkin seed oil. So in someone who's, getting a wider part line or thinning of the hair, that would be the oil you'd want to choose, maybe with rosemary as well. Rosemary has some science behind it. But often what I'll recommend is after retinoids, because retinoids at night can be drying, putting a little spot treatment with the pumpkin seed oil. The other thing is tea tree. I'm not a big on spot treating, as I had mentioned earlier, because we don't want to just treat the pimples. We want to prevent new ones from forming. But as far as spot treating, especially for those deep chin cysts that take a really long time to go away, we do want to do anything we can to reduce the inflammation and the scarring. You can make a formulation of about 20 drops of tea tree oil to 1 ounce of pumpkin seed oil and use that for spot treatment to acne around the jaw and the chin. And you could do that 1 or 2 times a day to help reduce it. You always want to dilute your tea tree oil because although it has a lot of antimicrobial properties, it also can be highly irritating to the skin. So it must be diluted in a carrier formulation. And in this case, I like the carrier of pumpkin seed oil because of the reasons I mentioned. Spearmint tea. So you could drink some spearmint tea, and that's been shown to help with acne. And then there are supplements that can help to balance hormones. And I'll go in a deeper dive into some of these supplements from one of my recent conferences at the Integrative Dermatology Symposium. So there's DIM, there's saw palmetto, inositol. Myo-inositol is great for PCOS and hormonal acne. And then there's the chaste tree berry, or Vitex, better known by, and that's another supplement that can help like perimenopausally to help with the lowering of the progesterone levels. And then lastly, I want to talk about prebiotics and probiotics. So prebiotics you should be taking every day. You can add it to your coffee. You can, drink it in the morning with your breakfast. But prebiotics are really important because we want to promote a healthy microbiome because our skin, gut, and brain are all interconnected. Okay. So we don't really have a formulation of like this probiotic is exactly what you need to take, right? Because even if you take probiotics, if you're not eating properly, they're not going to grow. It's like planting seeds in a garden. If you're not feeding them, and watering them, they're not going to grow into the plants you want. So probiotics can be tricky because it still comes down to what diet are you consuming to continuously feed that. But there was one study showing that the probiotic Lactobacillus rhamnosus, the subtype was SP1, has been shown to help acne. But what I want you to take away from this at the end of the day is supporting the health of your gut is absolutely essential for the health of your skin. So, this is a lot of information about acne, and you could see it's a really complicated condition. And as I mentioned earlier, it's $1 billion skincare industry for a reason, because there's not one treatment for everyone. So, what I want you to do, what I recommend is starting with lifestyle changes. And that is going to benefit your skin. It's going to be slow. You need to give it 8 weeks. Okay. Give it 8 weeks to make a change. You've been living with it for longer than 8 weeks. So you can give it 8 more weeks to try to make the changes. And this is a great time of year to start making changes, right? We have a new year and a new chance to start a new routine. And then start a nice topical skincare routine. So, I love salicylic acid. I use it. I think it's anti-inflammatory. It helps exfoliate, whether I want to exfoliate wrinkles or prevent acne and plugging of pores and just overall skin tone evenness. And if you have inflammatory acne, then you can do benzoyl peroxide cleanser. And, a nice skincare regimen. And there are dermatologists near you that I recommend you consult with. You can do it online. You can do it in person. You go to the AAD.org, American Academy of Dermatology.org, and spend your time and money getting a professional opinion from someone who understands skin, who personally just studied skin, only skin, and they understand skin and how to best treat it and understand it from a physiological perspective. And then something else I really wanted to talk about that is essential for everything. It's essential for your life. It's essential for your skin, is your belief system. So if you believe you are someone that has acne, you will always have acne. And if you are someone who believes you don't get acne, you will not get acne. Okay. So a lot of that is reprogramming in your mind what you believe in yourself, because we do manifest our health. And I've seen it year after year, people who struggle with acne for 20, 30 years, and they never see themselves as having clear skin. So what I can do as a dermatologist, or what I'm here to do today, is to give you information so that it can empower you to get clear skin. With that being said, though, you will not have clear skin if you always identify yourself as someone who has acne. So let's get you to clear skin and then reprogram that you are someone who always will have clear skin. And then we'll go from there. Okay, well, thank you for joining me today. And as usual, if you have any questions or comments, or you want other topics that we can discuss, I will be doing an AMA, a Q&A, whatever you want to call it, in the upcoming months now that I've restarted the podcast. And the best way to get in touch with me is on Instagram. Just DM me at Dr. Jen Haley, DrJenHaley. I'm also very active on LinkedIn, and I look forward to chatting soon. Bye.
If you're enjoying the Radiance Revealed podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, please give us a review, as that helps others to find this podcast. And if you want to connect with me, please visit my website, drjenhaley.com, or you can find me on Instagram at drjenhaley.
Hello, everyone. Just a friendly reminder that this podcast is for educational and informational purposes only. The statements and views expressed on this podcast are not medical advice. Opinions of guests are their own, and this podcast does not endorse or accept responsibility made for statements made by guests. Neither this podcast nor any of the information contained within it are a substitute for care by a qualified medical professional. This podcast is provided with the understanding that it does not constitute medical or professional advice or services. If you are looking for help in your journey, please seek out a qualified medical practitioner.